So insufficient medical supervision and follow-up, we see this particularly in teaching hospitals or in our other healthcare facilities where seniors do not supervise their juniors because of either laziness or maybe too much work, but there is no justification for anything that might result into patient's harm. The unnecessary delay of treatment, you've seen the patient, you've prescribed the medications or what needs to be done to a patient, but people that are supposed to give what you prescribed do not do it, and do it maybe after lots of hours, and this may actually find the patient dead or may find the patient not helped as it should be. Failure to acquire patient or family consent. You need to give the patient or the family or their family information on their treatment procedures such that they understand all the possible risks involved in the moving forward. If you don't and anything happens, you will be liable for the outcome. If this patient dies on the table without having consented, you will have behaved like a butcher who takes a cow to the butchery and kills the cow. So if the patients complain, if their relatives complain, I beg your pardon, then you will be held liable. You will be held responsible for that. Poor documentation. We all healthcare professionals write in the patient's charter, in the patient chart or patient's files. Please document indicating your grade, the time you did what you did. Indicate what you found when you are called or when you are attending to this patient. Make sure that everything is put down on the patient's chart, signed and stamped. If you don't, something that is not written is considered not done. Make sure that you do yourself justice and ensure that that is there. Poor hospitals leadership and coordination, it's extremely one of the challenges that we see. Leadership, governance, and probably coaching are some of the crucial things that we need to invest in through such meetings, because remember, leadership is something that is acquired. It's not something that is innate. So if you haven't taken time to help yourself learn a few basics of leadership, and you've been made a leader of a certain health facility, then you will be doing injustice to yourself, and you will be held responsible and accountable for your failure of omission or commission. Working beyond the scope of practices, this is extremely important. Of course, we have interns in some of these teaching hospitals, and we have hospitals where nurses want to say that they are doctors or and so on. We have this misrepresentation of healthcare professionals trying to masquerade as something they are not. That is hugely unprofessional. Please don't do that. Don't do that, because any outcome is going to be bad for you. So in conclusion, I hope I haven't bored you, Steve. In conclusion, I would like to urge stakeholders to collaborate and support healthcare regulators and make sure that the service we provide is through dialogue in order to address the professional issues that affect the public we all serve. Reporting of negative incidents at the workplaces in a timely manner can save lives. Kindly make sure that everything that you do is written down, and not for the sake of writing down, but try to write it down with intention to show that, to make sure that there is continuum of care. Whoever comes after you will find that healthcare professional X and Y did what they were supposed to do. And remember, cases can come 1 year, 2 years, or even 10 years after you have left the place. So make sure that you do what you do and do it professionally. through appropriate documentation and discussions with your colleagues. Reporting negative incidents is critical for our improvement of care. The good healthcare professional practice principles are the guiding tools for the day-to-day action of our healthcare professions, and healthcare professionals are supposed to work together and continuously improve our knowledge, attitude, and practices. And with that, I submit to the moderator. If there are any questions, I am ready to answer. Unfortunately, I'm still seeing people entering right now when we are supposed to be ending the presentation. I thank you so much, and I can see we are almost 100 participants. This is extremely good, and please be available as well for our next presentation because learning never ends. So thank you, moderator.
Okay. Thank you so much, Dr. Emmanuel, for the wonderful session. It was very interesting and educative. I've been myself able to learn a lot of things, and I hope everyone has been able to learn a few things. From the session, we've looked at a number of things: core values, integrity, professionalism, accountability. We've looked at the roles and functionality of healthcare professionals. We've looked at professional misconduct, and most importantly, the doctor has told us to be a good example in whatever field we're in. If you're a husband, be a good husband and a good example. If you're a wife, be a good example. And if you're into the medical industry, yes, being a good example. He has also talked about conflict of interest and how to handle it, and also the causes of malpractice. This has really been a good session, and we are very grateful, Doctor. A few reminders. I would like to excuse myself. I had internet issues in the beginning, so I was off. But for participants that have their devices named as itel, Galaxy, Infinix, please change your device name to your own name. This will help in attendance, and also it will help in being able to award certificates. So please change your names to your real names, full names. This will help so much. Also, we had a few disturbances from people that would not mute, but we hope that in the next sessions, we will all mute as requested. We have a few questions from the participants that were put, that I was able to note down. So I'll share them so that you're able to see them. Hello, Doctor, can you see the questions?
Yes, please.
Yeah. So I think it will be easy if you read, or if I can read for you anything you prefer.
Yeah, can you try to magnify?
Okay.
You could either increase the
size?
The font size or the percentage for projection. Yeah.
Is this okay?
That's very okay. Yes, I can read for myself on the legal medicine. This is, as I told you, the legal part is going to be presented in our next presentation. This was essentially ethics and professionalism for healthcare professionals. So number one, hello colleagues, I'm very pleased to join this important presentation. I request the facilitator to keep preparing such presentation regarding professionalism. I think this is a comment, but increase the number of CPD credits. Thank you very much. The organizers have heard that. I do have one question. Normally, we do believe that both universities and councils that train and provide licenses to us are the best institutions to be judged as incompetent. Regardless of the CPD, what do you think is the best way to solve this issue? Yeah. No, Look, I don't think the universities or the councils, just go down a bit, Agnes, number 2. I was on number 2.
Yes.
The university that awards the degree, remember the university gives you the knowledge. It tries to impart the attitude part. But definitely remember, for those of you that have been in the medical schools, either when I was, in the healthcare professional, because I've taught in the medical school and the paramedics. When we come to audit the university, we try to make sure that the basics in terms of healthcare education are met. And we make a lot of recommendations. And if those recommendations are not adhered to, we actually go on and even propose to the government to close them. So if an institution is going on despite challenges, but has been recommended to go on, it's because the councils were happy with the products that are going to come out of these universities or higher institutions of learning. So what I can tell you is that the councils, the best of the capacity they have, are doing the best they can. And the universities right now that are teaching healthcare professionals, which are the UGHE and now AUCA, I think they are not incompetent. They are not incompetent, and I don't think even the graduates are incompetent. Incompetence is essentially actually during the practice. That's when we become lazy. We don't read. We don't attend such meetings. We don't read. We don't discuss with our colleagues. Then you actually, somebody is right to call you incompetent. So I think our universities are not incompetent. Our healthcare professional regulators are not incompetent. Dear presenter, the presentation is excellent and enjoyable. How will you talk more about ethics and interprofessional collaboration, physics? Yeah, I think right now in the curricula that are being implemented in the medical schools, in the healthcare professional schools, this interprofessional collaboration is a part that is actually now considered. And so being a doctor, discussing with a nurse on the best way forward, discussing with a pharmacist on which best medication to give, discussing with the physiotherapist on how to manipulate a certain joint or a certain part of the body, discussing with the laboratory professional on how to get the specimen and process it. These are things that we are encouraging, that will continuously be encouraged, and it's definitely a way to go. Interprofessional collaboration is definitely something that must be emphasized, both at the university level and during practice. Remember, for me to collaborate with my technologists in radiology department, it's a matter of attitude more than the fact that it is the right thing to do. Because discussing with my technologist when we are going to do a CT scan of abdomen or MRI of shoulder on how he should do it and what to give me, it's not for my benefit. It is for the benefit of me and my colleague who learned something, and for the patient and the clinician. So if you don't, then you're actually also practicing malpractice. What do you advise to the health institution managers? For example, a patient with a pneumothorax dies because the institution does not have a chest drainage. Those kind of poor working environment, lack of resuscitation drugs, materials, is staff on bedside accountable for lack of adrenaline etc. No. There's no healthcare professional that can be blamed for having done the best he could. By the way, if somebody has gotten pneumothorax and because you don't have a drain, you shouldn't let this patient die, because you can even put in a needle and relieve the pneumothorax. So no patient should die of an emergency like that one unless you have minimal skills available. But at least the emergency care handling is now, I think, being improved right and down. So no healthcare professional can be blamed for having done the best he could or she could, despite the outcome, because he or she did not have the equipment. That is what we normally blame for the system, and there are a lot of recommendations that go to the Ministry of Health, and the Ministry of Health actually takes them in the good light, and you have seen a lot of equipment being bought in so many hospitals, and it is based essentially on the reports that are done for us to be able to maintain our best healthcare professionals where they are, they need to have a conducive working environment with healthcare professionals that are enough, with equipment and infrastructure that is. But you know, even Rome was not built in one day. So things can only get better, and no healthcare professional can be penalized for doing what he did, despite the outcome, because he lacked the equipment. Many healthcare professionals committed many faults, but they didn't know very well in malpractice or negligence. That is what I did explain. You know, negligence is, if a patient dies because you are negligent, it's not because you didn't know what to do. It's because you are just trying to be bossing around, bossing nurses, bossing other healthcare professionals, and you didn't reply when they called you. Negligence has got a set of definitions and what characterizes it. Malpractice is doing the wrong thing when you could have done the right thing. Do you think healthcare regulatory bodies do enough to monitor good practice of their respective professionals? If not, what would you recommend? I think the healthcare professionals do not do a lot, but they are doing the best they can, despite the fact that they could do more. And I think the issue here is that given resources, you know, when they tell us to pay our registration fees, we all fight. So what we want to do is to make sure that let us all support our regulatory bodies. Let us all pay our subscription fees. Let us all make sure that we support them. And then every health regulatory body has got a strategic plan. Of course, for them to implement their strategic objectives, there is always a monitoring and evaluation, and monitoring and evaluation is part of what actually is not implemented well, because they don't have the resources to follow it. And thank God the Ministry of Health is trying to come up with means and ways of supporting them. So as they get the means, definitely those who will do the monitoring and evaluation are ourselves. It's not the president of the council X, because he can't be everywhere. He will use his professionals to support him. Number 7, here we are having ethics, which is just asking what is right to do. What if an act is ethical acceptable but legal unacceptable? What is your comment? Scope of practice from bodies not recognized by health institution managers, e.g. many staff work beyond the scope, nurses care many patients ratio, anesthetists. Let us get something, one thing right. There is a difference between the scope of practice, and there is a difference. There's also a difference in having a limited number of staff, or what we call the staff-patient ratio. Practicing beyond the scope of a practice is illegal. If I am a radiologist deployed in Chibungo and I decide to make myself a surgeon, that is extremely dangerous. It is not allowed. However, if you are a nurse who has worked with a senior GP, who has worked with a doctor, who has been doing cesarean sections, when we learned cesarean sections in our medical schools, or even when we went to the district hospitals, we were mainly mentored by senior nurses. So you find some competent nurses who can do cesarean sections, who can do incision and drainage. It is called task shifting. And the World Health Organization allows task shifting. So definitely there is indeed a responsibility to make sure that all professionals respect their scopes of practice within their norms, and cannot go above. If you do, you will be looking for a disaster. Make sure that you do that. But the fact that some anesthetists can do more procedures and maybe not get motivated, or some anesthetists may anesthetize complex cases. That is, I think, we've been told that the scope of non-physician anesthetists has been widened, and we are in the process of credentialing and privileging our anesthetists, particularly at least at the hospital I work at, and this will spread all over. So we need to come to an understanding that because I trained in 1, 2, 3, 4, this is what I can be able to do. Because I didn't train in this, but I have worked with somebody who did this, I can be privileged to do that. And I think our system permits that. So that is something that is worth considering. But definitely going beyond what you can do or what you're allowed to do is definitely legal. How can prevent healthcare professional malpractice due to misunderstanding and respect of workmates? Because this is also a big issue. Malpractice and social contract is a slightly different thing. Interprofessional collaboration and working relationship is another thing. So let us all be people of self-respect, people who respect ourselves, and feel that we should do the right thing because it is the right thing to do. We do not need to be lovers. We do not need to love each other to work, but we must make sure that we work with each other amicably. If you don't, then you do not belong to that institution. We must make sure that we work together as professionals, irrespective of the stage of your profession, irrespective of how far you are advanced, irrespective of how good or bad you are. We must work with each other, and that is not optional. What percentage of patients' complaints in suggestion box? Is there a committee to handle that in all Rwanda health institutions? Yes, if you look at the patient charter, every health facility is supposed to have suggestions handling, and is supposed to have a dispute settlement mechanism, and they are supposed to evaluate all these incidents, and these incidents are supposed to influence a best or a better working environment for the professionals and for your clients to come back. When a patient complains, surely their complaints should be taken seriously to make sure that those Host, can you not mute me? I think somebody didn't hear me well. So that's it. Then on my behalf, the lack of interprofessional collaboration is due to the fact that leaders do not treat all professionals the same way, from MH to the hospital leaders. Just think of that. That is a personal opinion. If I was the Minister of Health today, I would treat all the healthcare professionals the same way. So I believe and trust our healthcare leaders definitely value and understand what a doctor does, a pharmacist cannot do. What a pharmacist does, a doctor can't do. What a nurse does, I can't do. And what a laboratory technologist does, I can't do. So in life, you support me, I support you. And there is, for those of you who read books, just go and read a book by Stephen R. Covey, where they talk about the third alternative. You know, it's not about how good I think or feel I am. It's actually about how we feel about each other. So any moment you think you have respect for yourself, remember that respect is earned. If you make yourself a nuisance, everyone else will treat you as a nuisance. And from what I understand, good doctors respect nurses, good nurses respect doctors, good nurses respect physiotherapists, they respect laboratory technologists, they respect radiographers. Good radiologists must respect radiographers. If they don't, then that is a recipe for disaster. So let us all promote to the best we can interprofessional collaboration. Let us all understand that we complement each other and not supplement each other. I thank you very much, ladies and gentlemen. Thank you for the opportunity to talk to each and every one of you, and hope to see you in the near future. Have a great day, have a great afternoon, and God bless you all.
Thank you so much, Doctor, for the questions answered. We have a few hands up that I think maybe they have questions too. I would like to welcome Uwamahoro. I'm going to ask you to unmute, and then you could ask your question. Hello, Uwamahoro, your hand was up. I think as she's setting up, you are welcome Mubahire M. Claire, who also has a hand up. Please unmute and ask the question to your doctor. I'll ask the last person, who is Wababjay Siaraka. Unmute and ask your question because your hand was up.
And thank you for the good presentation you had. I would like to ask to give my comment in Kinyarwanda if it is possible.
Yes, it's okay.
Dr. Emmanuel yakoze cyane ku nyigisho nziza tugejejeho. Nagira ngo ngire comment ngira ku ba health professional ubwabo. Hari ukuntu abaganga bose baba bari the same specialty, ariko ugasanga muganga aragenda avuga muganga mugenzi we ko adashoboye. Iyo uri umurwayi rero bituma bigaragara nabi ko hagati n'abaganga ubwabo, abavuzi ubwabo nabo batemerana. Niba umugenzi wawe uzi ko afite weakness runaka, ntabwo ari byiza ko ugenda umubwira abarwayi, bityo bizatuma uwo munsi uwo muganga yakoze abarwayi batazi. Haba numva rero nacyo ku ruhande rw'abakora mu mwuga w'ubuvuzi nabyo byakosoreka ku buryo ibanga ry'abaganga niba mugenzi wawe afite weakness runaka si ngombwa kugenda umuvuga umubwira n'abandi. Niyo comment nagira ngo nshyireho. Murakoze.
Urakoze cyane. Twakire Dr. Jene to ask or comment. Thank you so much.
Murakoze kandi turabashimiye ku mahugurwa twabonye uyu munsi. Ibibazo dukunda kugira mu bitaro by'umwihariko ni ku bijyanye n'imyemerere y'abarwayi, abakunda kandi baba bakeneye gufatirwa icyemezo by'umwihariko ni abarwayi basengera mu itorero ry'abayehova batemera guterwa amaraso. Ugasanga rero umurwayi niba ari umubyeyi akeneye guhabwa amaraso, umugabo warabyanze, umwana muto akeneye guhabwa amaraso, umubyeyi warabyanze. Ese iki kintu kugira ngo gihabwe umurongo uhoraho kibashe gukemuka mu buryo burambye, ntabwo habaho ibiganiro binumvikana. Abayobora iri torero ntabwo bazapfa kubyemera, ariko hakabaho umurongo wanditse wemewe mu buyobozi ku buryo umurwayi ukeneye guhabwa amaraso imyemerere yiwe itamwemerera, ariko igihe noneho atabasha kwifatira icyemezo ngo asinye konsantoma, hakaba hari uburyo bita bikemuka bidasabye kubanza rimwe na rimwe kubikora wihishe, cyangwa se kurekuka ugahora n'ingorane nyinshi cyane zitewe n'uko atabasha kubona amaraso ku gihe. Twumva byadufasha muri professional councils bakabiganiraho bakabiha umurongo. Murakoze.
Murakoze. I think Dr. yadufasha gusubiza cyangwa kongera comment on that.
Murakoze. Nahoze ndeba ariko hari amazina atari amanyarwanda, sinzi ko ababajije batakumva cyangwa se batumva icyongereza. Kukivuga yenda bishobora kuba bigoye, ariko kukivuga byagorana, ariko kucyumva muracyumva. Is that okay?
Yes, turacyumva nta kibazo.
Excellent. Ibyo muvuze mu by'ukuri ntacyo nakongeraho, nibyo ni facts, kuko mugomba kuba namwe muri senior members of our professions. Ikintu ashaka gusubiraho gikomeye ni iki kintu cyo gusebanya. You see, what people don't recognize is that, let's say there is a Dr. X and Dr. Y and Z. If a patient comes to you and says, I have been seeing Dr. X and you are Dr. Z, and Dr. X gave me or told me 1, 2, 3, he gave me this treatment, I've been following him, and my condition is either not changing or has worsened or is getting better. So, and Dr. Z starts, no, that doctor is stupid. You know, he's always drunk. He's that is extremely dangerous. That is a profession that cannot grow. Because saying that Dr. X is an excellent doctor, but he gave you a medication that probably we can add something else to it, or we can change because our bodies react differently to different medications or drugs, that cannot cost you a lot. But any moment you talk ill of me, this patient will actually go and talk about it. Remember, because some of our neighboring countries try to undermine our doctors here, and when a patient takes results from some of our hospitals or go with medical reports, when they reach there, they tell them, oh, shame, this is what you've been getting. These people were almost killing you. And that's extremely dangerous. And instead of actually saying that, oh, so they were giving you this. And sometimes you find patients are on the right medications, and you find the diagnosis that was posed was right, but because there is something called negative competition in business, he wants to be glorified. And I hope you have heard something called glorification of mediocrity. That is a mediocre way of thinking, because if you think you can be better through talking ill of me, then you have missed a boat. I can talk about Dr. X being an excellent doctor and telling this patient, because Dr. X has done 1, 2, 3, let us try this one as well. Remember, medicine is not 1 + 2. It is not an exact science. The interaction of a certain medication in me and in you might not be the same. So again, it is not something that you can tell the Minister of Health to say, I'm putting out an instruction to say, please stop talking about each other like this, or the council's talking, giving an instruction, doctors don't, no. That's an attitude problem, which will definitely change with time, because the dignity that our leaders keep telling us will be a real dignity. You cannot have a dignity for yourself if you undermine your colleagues. You can only develop if you praise what is good and say, no, I think you're not doing well. This is the self-criticism that we talked about. So there is no magic bullet for this. There is no magic answer for this. All we can do is let us all improve to be excellent with each other. We all went to school, studied what we studied. And as I said, you cannot do what X can do. You cannot do what Y can do. So let's try to respect each other, respect each other's profession, respect each other's stage of development. And it's only then that our profession will rise and be accountable. Otherwise, nobody will progress by undermining the other. I thank you very much. Otherwise, your comments were excellent. Thank you.
Thank you so much, Doctor. As we are winding up, I would like to thank the doctor so much for the great session. It was educative, and also the participants for participating. For the participants that were not able to join, since the maximum capacity was 100 people, the session was live on YouTube, but there will be the course will be posted on the Health-Edu platform, and participants will be given 1 hour online to go through the material and answer some questions before they can be given certificates, so that we can see who followed and what, if they've been able to get something from the course. The course will be posted today before 9. So I'll give a word to Mr. Damasen to close the session. Thank you so much.
Thank you. Thank you very much. We had about 100 people, so many others who weren't able to because of the capacity of our infrastructure. But we have enabled them to have access to this content online. And as Alan was saying, we will post the course on our platform, and all of you will be able to get this presentation and then a few questions before you can get a certificate of completion. Thank you very much. And as the doctor said, the legal part is going to be presented next. We will be, we are going to inform you because we have all your contacts so that you can attend the second session. Thank you very much and have a wonderful evening.
Wonderful evening.